Now, at least 40% of trauma cases are related to alcohol. Government has renounced new COVID-19 regulations and moved the country to lockdown alert level 3 again. Now, with the new restrictions, one of those is alcohol sales for off-site consumption will be restricted from Monday to Thursday. Is it going to make any difference, though? Let's get some reaction. Chairperson of the South African Medical Association. It's always a pleasure, Dr. Angelique Coetzee. I'm looking and referring to a report, the drug and alcohol report from earlier this week, the review. Do you think it's going to make a difference, Doctor, as I see you joining us again? There you are. Good morning. Do you think the restriction on alcohol is going to make a difference, or do you support the call for alcohol to be completely banned?
Well, if I look at what we are seeing, this restriction is not going to work. It makes absolutely no sense to have off-site restrictions on Saturdays and Fridays, but you still then open up your other places like your taverns and your restaurants. You allow them to sell alcohol, and people can then go and drink there and then drive back home. And we know drive and drunk. We know at these taverns and pubs, and sometimes that's where you will get people getting into fights. They get, and that will place a strain onto the healthcare sector. It doesn't make any sense.
Do you know at all, Doctor, if government had spoken to organisations and experts such as yourself or other organisations about the knock-on effect of closing down alcohol for exactly what you were just referring to? People will drink more at a restaurant because they can't buy alcohol. Did they consult with you at all?
No, they didn't consult with us at all. That is, I think it's an oversight, and I really think that government should not only listen to a select group of people or an elite group of people. In cases like this, it is extremely important that organizations such as SAMA be consulted, because remember, we are sitting there. We are the first port. We know what is happening. As SAMA already started about 3 weeks ago, warning this is going to come. You saw this. You saw the figures yesterday. 13,000 people plus with COVID-19. Majority in Gauteng and in the Western Cape is also now getting their fair share. But they don't have to worry. If the school's holiday started, we will see the Gautengers traveling to KwaZulu-Natal, Eastern Cape, Western Cape, taking the virus with them.
COVID-19 doesn't move by itself, Dr. Coetzee, as we well know. But you just brought up 2 points that I thought are very interesting as we look a little bit further down the road. The restrictions currently, the slight reduction on alcohol usage. You are supporting the call for a complete alcohol ban. The drug and alcohol review is supporting that. Would you say we need a tougher lockdown level? No interprovincial travel, no alcohol at all. Would you support a call for that?
That is, we would, but I think it's already too late. This should have happened when we started to warn that we are amidst the third wave, and officially. Then, if we then did some strict measurements, this would have helped. And also that SAMA right from the beginning said that we're not happy with the measurements from the first level that was announced up until 2 days ago. And we think it's going to bite us because this is not an easy time of the year. It's winter. It is extremely difficult.
Do you think that government has an idea, Dr. Coetzee, of what is actually happening on the ground? Earlier, you said to me that you, as your organisation, are the ones on the ground having to deal with this. Do you think there's a massive disconnect between what government is saying, what you're saying, and what is actually happening in the hospitals? Because there's already a grave shortage of beds currently, never mind the scenario that you're painting that could happen in the next few weeks.
Yeah, definitely. I think we are a country that loves to listen to people not working at cold face, not in the field themselves. We love to listen to modelers. We love to listen to people sitting, in offices. making policies. We love to listen to them. But at ground level, we see a different picture. And as I've said, we have been warning that this is going to happen. It's not that we haven't said that. And we are again in the same dilemma, except now it's worse regarding admissions, regarding beds, regarding home oxygen, trying to get people better at home level. It is extremely difficult. It's not easy. And on top of it, someone is worried that we have now seen that some of the elderly people have been vaccinated while they already have colds and flus, but it turned out to be COVID-19. So yes, the scientist says, no, you can be vaccinated even if you have mild COVID underlying, you're not, and you don't know that. But for us at the primary care level, it's horrible because those patients are sick. And so the question is it because the immune system is down now? Is it because, it's a combination of being vaccinated while you were sick? We don't know. And again, I don't think there's very good studies at primary care level. I'm not talking about hospital level. I'm talking about primary care level.
Doctor, you mentioned beds a moment ago. Just how bad is this? Depending on which government official you speak to on any particular day, you're going to get a different version. Hospitals are either coping or they're not doing as well as they would hoped. But that sounds to me like they're glazing over the situation. Give me the honest truth, Dr. Coetzee. How bad is the bed situation?
In Gauteng, it's very bad. Especially, I can't talk on behalf of the public sector, but I can promise you what we're seeing in the private sector, it should be the same in the public sector. Remember, we also lost Charlotte Mocheke Hospital. It is bad. I don't care what the officials is saying because they are not there. Once if they are going, you know what happens? If they do visit a hospital, there's a lot of window dressing. And because one way or another, our country official thinks that if you do window dressing, you make it look better, then everything is okay. They don't understand that you actually need to show them the true picture so that we can fix the system. And that's not happening. And yeah, you know what? Those officials that saying there's beds, please let us get their private cell numbers. Let us phone them when we have a problem admitting a patient, regardless whether it's a public or a private patient, because government, in the end of the day, are responsible for all people, not only public or private people. So let us get them. Let they help us finding beds and oxygen.
I think it's a great initiative. I think we should see a few ministers standing in a hospital behind the reception desk, standing in a trauma unit, driving around in an ambulance, looking for a hospital for a dying family member. I actually think it's a brilliant idea. Dr. Coetzee, let's talk quickly, if we could, about the vaccination rollout. Or let me be honest, let me say that again. The lack of a vaccination rollout. It's not happening. It's happening at a very, very basic level. If you work out the maths based on the rest of the world, we are dealing with a vaccine rollout that's going to take years. I'm going to literally have turned 40 by the time I might get a vaccine.
It's true. It's true. It's very slow. We have such an amount of vaccine sites. It's again one of those things. The more sites we have, the slower the vaccines are rolling out. We are having, I think, over 5,000 sites. We still managed to get 85,000 people vaccinated per day the last 2 or 3 days. And that's it. I know that we also have a problem with our vaccines, but we're not going to make it. And remember, in this third wave, the lack of vaccines, as well as people not being able to get vaccines, especially in the rural areas. Also, even if you vaccinate yourself now, I think we will see in the fourth wave the benefits. We won't have the benefits now.
Dr. Coetzee, I'm going to say thank you very much. I think your phone ringing was a minister phoning you to ask if they can come and volunteer. That's wishful thinking.
So.
That's wishful thinking, Dr. Coetzee. Thank you very much, indeed, for joining us. South African Medical Association, Dr. Angelique Coetzee could not be more straight to me as far as the problem. There is a disconnect.
Listen.
There is what is government is telling us.
Yeah.
That's what they're putting on social media. They're massaging the message.
Right.
And you have what's happening on the ground.
That shook me, I have to be honest, because when she said there's a lot of window dressing, and as far as officials are concerned, it's a problem because absolutely we need the reality to be shown. We need the true, reality on the ground to be revealed. So something can be done about it with the urgency deserved. So
I actually want to challenge. I want to challenge somebody in the health ministry. I want to challenge a minister. You've heard the challenge from Dr. Angelique Coetzee. Go join her. I'll bring a camera. I'll speak to my managers here. I will take a camera myself to a hospital, and I want to see a minister do the work of the people on the ground. I will volunteer my time.